Hi, my name is Dwayne Anthony Francis. I'm a licensed clinical social worker here in the state of New York. The name of this show is Mental Health Concerns in the African Diaspora. My goal is to weekly put out one or two videos discussing topics that are pertinent regarding mental health in the African diaspora. What has been a topic for several months in every ethnic group and race on the planet is COVID-19. The LA Times on April 25th, 2020 reports that the death rates due to COVID-19 among Blacks and Latinos aged 18 through 64 in California are disproportionately high in comparison to whites and Asians in that same state. Blacks aged 18 to 49, who comprise 6% of the total population there, account for 15% of deaths due to the pandemic. Potential underlying causes for this are a higher prevalence of socioeconomic disparities and unequal access to healthcare, in conjunction with higher rates of heart disease, diabetes, obesity, and asthma in both the Black and Latino communities, each of which have fewer resources and higher rates of underlying disease. All of this combines to create the horrific reality that Blacks in that part of the country are dying at nearly 2.5 times their share of the age group, as often due to COVID-19. Whereas numbers of Latinos in that same age group of 18 to 49, their numbers go down as the patients get older. The opposite is true for whites and Asians. In their groups, those in older age groups die as a result of COVID-19 of a ratio that is 2 times more likely as the death rate increases among 65 or older in comparison to those 18 to 49. Sadly, for Native Hawaiians and other Pacific Islanders, their death rate is 4 times their share of the Hawaiian state's population. They are then followed by Black and Latino Californians. Here in New York, U.S. News reported on April 8, 2020, that Hispanics make up 1/3 of deaths attributed to COVID-19, with African Americans, who are 28% of New York's population, comprising 28% of reported deaths, with whites being 32% of the population, accounting for 27% of the COVID-19 deaths. What I am seeing firsthand as I go about my day during this international crisis is alarming, to say the least. Across all racial and ethnic groups, there are great numbers of individuals who have not a problem not adhering to suggested health department guidelines, and go about their day interacting with others, wearing no face mask or covering whatsoever, let alone gloves. In my opinion, this is a selfish and foolhardy form of denial. Why I say this is because all the evidence has yet to be gathered, meaning that we barely have an understanding as to how the disease is transmitted. There is no present cure, nor is one thought to be possible in any semblance of immediacy, with any semblance of immediacy, excuse me. It has been discovered that many young adults up to the age of 25 are asymptomatic, meaning that they contracted the disease but show no symptoms. It is unknown whether that same group are in fact carriers. For your own sake and that of your neighbors, wear a face covering. Keep a suggested 6 feet distance from others. Use gloves and avoid touching your face if you haven't washed your hands first. The reality is, we members of the general public and the medical community are learning about COVID-19 as we go along. America is destined to suffer doubly as long as we refuse to show the level of self-care and a modicum of respect for our neighbors. We have a president in office who is so blinded by his greed and his zest to keep the stock market rates up that he is a continual source of misinformation that many take for fact because of the high office that this gentleman holds. What we do know is that we really don't know shit where this virus is in concern, and need to take all precautions until we know what we are dealing with. There are many theories floating around about the origin of COVID-19 and possible elitist plans for population control as the root cause of what is occurring in worldwide society. Dr. Buttar can be found on YouTube. He has many facts and offers many theories regarding an elitist conspiracy to use the fear and anxiety prevalent internationally at this time as an avenue to promote varying forms of dictatorial government control. His video, Difference Between Danger and Fear, expounds on that perspective. An excellent video to look into regarding this topic is FEMA Whistleblower Exposes the Mark of the Beast. These videos will help you gain a further understanding of how the situations that are playing out with the pandemic and the resulting present day anxiety ridden environment, which is fodder for manipulation. Beneficial to gaining knowledge of what is playing out economically and politically in the world right now, in particular here in America, is information being provided by YouTuber Amazing Polly, whose videos are a must watch, in particular, Who Rules Over You, Not So Trusted Voices, Real World or Simulation, and Let's Get Them All are all extremely informative. Lastly, but not the least, I recommend the film Out of the Shadows. And on a spiritual note, read Ephesians 6:12 and investigate the perspective that our struggle is not against flesh and blood, but against the rulers, against the authorities, against the powers of this dark world, and against the spiritual forces of evil in the heavenly realms. It is my opinion that these adverse times that we are living through is the Almighty's way of forcing us to stop and look at ourselves, our fellow man, and the world that we exist in. Take time to perform introspection. Take advantage of voluntary quarantine time and begin to learn yourself. Take a look at how you relate to your feelings and those of your family members and neighbors. Learn the good and bad sides of yourself, and most importantly, learn to accept all that you are and love yourself. It is from love of self that we can begin to love all of God's children. And well, won't it be a perfect world when we can feel and show genuine love and concern for self and others? All right, so that's my offering for today. Now, I took a photo of this. I don't know if I'm going to be able to post it, so I'm going to show it to you here and hope that everything shows. Am I doing this right? Okay. All right. And back. Okay, there we go. And let me see if I can tilt it a little. Okay. All right. So these are the videos that I had just mentioned in the movie. Okay, and sorry that it's so unprofessionally put into the film, but I'm a novice at this. It's the first one, so it's a little hokey, and I'm okay with it. I hope you are too. But here's the information for you. All right. I hope that some of this information was helpful, um, and I look forward to making more videos and giving you information on mental health. Now, where anxiety is a concern in COVID-19, you know, people are stuck indoors a lot of times, or they're afraid, they find themselves afraid to go places. A lot of concerns that are going on now are anxiety related, you know, due to the fact that we simply don't know, and that there's a lot of change happening, you know, and the uncomfortability of the unknown. You know, we have alternate theories going on as far as are people trying to profit off of this pandemic? And are these people actually in positions of bias rule? That if you listen to these videos, watch these videos, there are quite a few elitist names that get shot back and forth, showing actual connection to means of gaining monetary wealth from what's going on with this pandemic. One of the avenues they present is that telehealth, which I'm a great proponent, which I'm a big fan of, a great proponent of, is something that's going to be pulled together, and a fortune will be made off of this because people will have been put into a state of fear where they'll be afraid to go out not knowing if they can contract this, what the severity of it or the repercussions of it can be. Um, and People are just out of sync for the simple fact that the world is out of sync right about now. If you're feeling anxious being at home, then maybe it's time to pick up the phone and call a friend. If you don't have any relatives or friends, give a call to your local church. If you're in New York and getting groceries is a problem, if you're disabled, elderly, or you have any other hindrances making it to a supermarket, call 311 and they will let you know about city meal drop offs and who is eligible for those. Um, Again, take this time and sit with yourself, get to know your family, Um, God forbid, families that might have to actually start cooking meals again instead of throwing stuff in the microwave and just heating stuff up, and maybe have some actual conversations. And I know this is a biggie, but it might actually come to people sitting down at the dining table as a family once again, as we did when I was a boy in the 60s. You didn't come in after 6 and there was an argument how most of America was at their dining table at 6 p.m. years ago, not too far in the past, at least not in my memory. Perhaps that's a note that we need to revisit, is for the family to redefine themselves by getting to know each other, you know. Well, anyway, that's my message to you. If you can get out the house and feel safe going for a walk, go to the park, get yourself some fresh air, take the kids out, um, and let them get some stress off of their shoulders too, because this wears on everyone. Voluntary quarantine, a lot of unanswered questions, and people being home who are used to being out doing a 9 to 5 or being in school and or not being around their family, as much as they might love them, you know, enough so that now that you have all this time and you have to be in a goodly portion of it, heads are bumping, and maybe this is a good time too to try to work out, what have been difficult paths of communication within families. Learn how to talk to each other. All right, everyone take care. And next week I will be putting up a video on how to. Well, I'll be putting up two next week actually. One will be to discuss how mental health and mental illness are defined, and another one will be on how to start a private practice utilizing video and telephone. All right, and although that for that second one, that information is pretty general, you will have to check with your board of professions in your state to see exactly what their guidelines are. But I can give you the basic structure, okay? And for those of you in New York, I could plug you in all the way. All right, and I'll be putting those out Sunday and Monday. All righty, everyone, take care and be well.